I'd like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to give an update to several previous videos I've uploaded that go into detail about my journey thus far after being diagnosed with vaginal atrophy and being put on VagiFem as my course of treatment. So I'm going to give a quick recap for those of you who are new to my channel, but if you are not and you're already familiar with all of these different things, then please feel free just to skip forward. I was diagnosed with vaginal atrophy about a year ago now and put on VagiFem as my course of treatment. And after about 6 weeks, the VagiFem worked exactly as it was supposed to, took all my symptoms away, and made me feel a lot better. Now, I do have a video about all of these different topics that I'm going to be talking about. There are several individual videos that I've uploaded, so if you haven't checked those out, I hope that you will, kind of, get you up to date on everything I've gone through thus far. But then after being on the VagiFem for about 6 or 7 months, I started to notice this weird discharge that started off being this grayish blackish color until eventually it turned into this brownish color. I did go in to see my gynecologist, who was a little concerned since I have been postmenopausal for over 5 years now. And even though it's not the traditional, like a light pink or a red color, apparently it's still considered postmenopausal spotting. He did do a pelvic exam and didn't see or feel anything of suspicion, but he still wanted me to make an appointment to have a vaginal ultrasound done, along with a procedure called a sonohysterogram, which is where a tube is inserted into the vagina. The uterus is filled up with a saline solution so that he can look in all those cracks and crevices just to make sure that it's not uterine cancer, which is where he was kind of leaning towards, just wanting to make sure that that wasn't what was going on. Unfortunately, it was going to take 2 months before they could get me in. In the meantime, I started to also experience this really bad pain in my lower abdomen to the left. I kept saying that it felt like it was near where my left ovary was located at. I did go to the emergency room and had a CT scan done that did not show anything, at least not that they reported to me. I also went to my gastroenterologist and had a colonoscopy, an upper GI, which is the scope down the throat, and then also a HIDA scan just to make sure this didn't have anything to do with my gallbladder. And again, I have uploaded videos on all of these different things, and none of those things showed anything that was wrong, and as far as those particular tests went, everything looked normal. Then one very snowy day in December, I was finally able to have my test done. Of course, it had to be on the one day that we had this terrible snowstorm, and I hate driving in it, but finally made it to the appointment, and the ultrasound showed that I did have 3 fibroid tumors on my uterus, and then it also showed that I had a small cyst on my left ovary that measured 9 millimeter by 9 millimeter, which is considered just under 1 centimeter, so relatively small. From there, he did the sonohysterogram, which it's in itself, having the saline solution put into the vagina wasn't painful, but when he had to take a sample of the endometrial lining to send away for a biopsy, I'm gonna be honest in saying, at least in my case, that was extremely painful. And I just laid on the table and kind of just said, oh my God, hurry up, please hurry, until eventually it was done. Probably in reality, it took about a minute, but in my mind, it felt a lot longer, and I could tell if he felt bad. Obviously, I don't think most doctors anyways really, take pride in knowing that they hurt you, but obviously it was something that needed to be done. And so, although that cyst did not really meet the criteria for being cancerous, since it was perfectly round, usually a cancerous mass has some irregularities to it. It was also very small. They don't tend to worry about cysts on the ovaries that are 5 centimeters or less, and since mine measured just under 1 centimeter, was still considered very small. And then also it didn't have any type of blood flow going to it, since when it's a cancerous mass, usually there's some type of blood supply that goes to it that is what helps to feed it. He still wanted me to have a CA-125 blood test done anyways, since the risk of ovarian cancer rises with age and after you've gone through menopause. So I had that done, and then he also was going to send that biopsy away as well. I did get the results back about a week and a half later. The CA-125 blood test came back at 12, and again, 35 or higher is when they tend to worry, so that was definitely well under that 35, which made me happy. And then the biopsy came back negative as well. And so at this point, I just had to wait and have that ultrasound repeated to see what was going on with that cyst. Personally, I was worried about the fibroid tumors because, again, I was having that brown discharge and also quite a bit of pain. And I know that fibroids can cause discharge and can cause pain. But in his mind, I think he was so worried about that cyst because he didn't want it to be cancer or turn into cancer. And so I think his concern was that. And then, if that turned out to be okay, then maybe in his mind, he figured we would talk about the fibroid tumors after that. Because I also know that estrogen is what can help fibroids to grow. And considering once a woman goes through menopause, usually the fibroids that they had would shrink due to the fact that the ovaries are producing a lot less estrogen. Because estrogen feeds them, your body's no longer producing it, or at least in very low amounts, and so the fibroids will tend to shrink. So because mine didn't, I actually had more than I did, like I had an ultrasound done 2.5 years prior to that, and it only showed one fibroid tumor. So the fact that I now had 3 of them told me something was going on that was causing these fibroids to either pop out or to grow. And so I made the decision at that time that I was going to stop using the Vagifem and hope my vaginal atrophy didn't come back. And I can say after about a month or so of not using it, the discharge did go away a little bit, but most importantly to me, so did most of my pain. So all of that pain that I had been experiencing seemed to subside. And so in my mind, I really believed that it had something to do with the Vagifem, although my gynecologist said, no, I don't think that has anything to do with it. But again, I highly disagree. So the reason I'm doing this video, and again, I apologize to those of you who have already watched all those videos, and so this was a little bit redundant. Hopefully you were able to fast forward. But the reason I'm doing this video today is because I did go back in to have that second vaginal ultrasound repeated, and I just wanted to give everybody an update as to those results. And so it was a different ultrasound tech this time that did it. And so the first question I asked was about the fibroids. I said, do you still show 3? And she said, I do. Never did ask her the measurements and never did find out the previous measurements. At some point I will. But, obviously, again, I was more concerned about that cyst on my ovary just to make sure it hadn't grown and wasn't, maybe turning into cancer. So she said, well, it looks like you had 3 cysts on your ovaries. And I said, no, I only had 1. She's like, really? Are you sure? And I said, yeah, I'm positive. I said, I know they said I had 3 fibroids, but I was only told I had 1 cyst on my ovary that measured 9 millimeter by 9 millimeter. She says, okay, well, and she kind of showed me. She said, here's this one. She said, it's now measuring 6 millimeters by 6 millimeters. So that meant it had gone down in size. She said, but then you have another one. She said, but it's very small, so small that we probably wouldn't even refer to it as a cyst if you were still having your menstrual cycle, and we would call it a follicle, which is what the egg comes out of or bursts out of. She said that's how small it's considered. And then nothing ever got said about the other one, so I just assumed it was like the second one that she said, just so small that they really would have called it a follicle rather than a cyst had I not been in menopause. From there, the ultrasound was done, so I got up, got cleaned up, changed, went in to wait and see the gynecologist. And when he first came in, he confused me because he looked at the report and he said, well, it looks like everything's the same. And I said, well, no. I said, she told me I had 3 cysts when last time I only had 1. And then she told me that the one main cyst that had measured 9 millimeter by 9 millimeter was now 6 millimeter by 6 millimeter. So he just looked confusingly at the report and he said, okay. He said, I'm a little confused here. He said, I'm going to have to go talk to her and I want to look at it for myself. So about 15 minutes later, he came back in and he said, well, you're right. He said the one cyst did shrink. It went from 9 millimeter down to 6 millimeter. So that's good. He said, but what she was showing was a little something on the outside of your left ovary. And he said, and so I went back and I looked at the previous ultrasound you had done and it was on there as well, but for some reason was never marked down on the report. And I said, well, what does that mean? And he said, I don't know. It's very small, whatever it is. He said, I'm not especially worried about it right now, but unfortunately, there's no way to definitively know what exactly it is or what's caused it. I said, okay. I said, so what does that mean? Like, where are we at right now in this process then? And he said, well, you've got 2 options. You can either come back in another, 6 to 8 weeks and have that ultrasound repeated again, or you can go ahead and opt to have the surgery to have both ovaries removed along with the fallopian tubes. And so, of course, I asked his opinion, what he thought. He said, well, I mean, I can't tell you what I would do. He said, but I can tell you what my wife would do. In fact, this is what I do for a living. And he said, I can't tell you, there's probably not a day that goes by that woman doesn't say, just take my ovaries. I don't want them. I don't want to end up with cancer. Just take them. So if it were my wife, she would be like, oh yeah, let's do the surgery. But only you can decide what's best for you. And I said, okay, well, what do you think the chances of this being cancer, turning into cancer? And he said, given all the things that have gone on thus far, your CA-125 blood test, the size, the fact that the other cyst is getting smaller, he said, for all I know, this could just be that cyst maybe leaked a little bit of fluid, and maybe it's the fluid. You're ultra low risk at this point. He said, maybe, go home, think about it, do a little research. Little did he know that's all I've done lately. But the other thing you can do, perhaps, is go ahead and make that appointment, come back in, say in 6 weeks, have the ultrasound repeated. In the meantime, set up the appointment for surgery. And then after that third ultrasound, see what's going on. If it's still there or if you're still concerned, then go ahead and have the surgery. He said, if it were me, that's probably how I would handle it, just so that I could check all the boxes and know that I did everything I could before opting for that surgery. So then my next question was, well, what are the risks involved with the surgery? He said it is done laparoscopically, so the incision site sometimes can get infected. He said that's one of the main risks that come along with it. He said, although it's rare. I can tell you that I've been doing this for 30 years. Thankfully, I haven't lost anyone yet. Ha ha ha. And then said that there's two problems he ever had. He said one woman was extremely skinny, was a heavy smoker, and then after the surgery, she was coughing so much that she ended up hemorrhaging somewhat. He said, although she went to the hospital and got taken care of and she was fine. You're not that skinny and you're not a smoker, so I wouldn't worry about that. Yeah, thanks for telling me I'm not that skinny. And then the next thing he said is he had one patient who had several cesarean sections, and so she had a lot of different scar tissue. And he said it can make it very difficult to go through that scar tissue because you're not sure what's on the other end of it. And sometimes either the bladder or say the colon can get punctured. In her case, unfortunately, he made a small hole in her colon because he wasn't able to see what was on the other side of all that scar tissue. I have had 5 children, all have been natural vaginal births, so I don't have to worry about a C-section scar, but I did have a umbilical hernia about 5 years ago that was repaired. And he said, okay, well, that's definitely good to know, because in that case, I would probably go in a little bit of a different direction just in case there was scar tissue there. He said, other than that, that's really the main risk that you're going to encounter. So I took the brochure from him that he gave me, came home, really thought about it, and at this point, I think I'm going to agree with his advice. I already have an appointment set up to have that ultrasound repeated in 6 weeks, so it's going to be like the beginning of May, and then I'm waiting for them to call to set up the appointment for the surgery. So after I go back in, see what's going on with, whatever is going on with my left ovary, this crazy left ovary of mine. And that's the other thing. I asked him, I said, well, will you just take the left ovary? He said, heck no, we're going to take both. He goes, why would you want to have that surgery and then 2 weeks later find out, oh no, now there's something on your right ovary? He said, no, we'll take both ovaries and both fallopian tubes. And I said, what about the uterus? It does have fibroids on it. He said, no, your uterus is perfect. He said, we don't want to take anything more than what we have to take. He said, so let's leave the uterus intact. Cervical cancer and uterine cancer are certainly have higher success rates in treating. We're going to leave that uterus as it is. He said, we're not going to touch it. I said, okay. That sounds good to me. So that is where I'm at in the process. I now have to wait. As I've said in all my videos, it seems to be that's all I ever do in my lifetime is wait. But I have to wait until May to have that third ultrasound done, see what's going on with it then. And then even if, let's say, best case scenario, that cyst is gone, whatever that is on the outside of the ovary, I still think I'm going to opt for having the surgery done anyways, just because what if it comes back? What if it turns into cancer? Like he said, I have been postmenopausal for 5 years now. I don't need my ovaries anymore, and taking them out really isn't going to be that big of a difference to my body. So at this point, I think no matter what, I'm going to go ahead and opt for the surgery. But it would be nice to have that third ultrasound done, just like he said, so I can check that box as well and be able to definitively say, okay, it has now been, 2 months, 3 months, whatever it is going to be at that time. And this is what it's doing, and this is where I'm at. So at least I'll have that answered in my head for me. So as always, if you have any questions or comments, please feel free to leave them. I'm always happy to answer anything that I can. Also very curious to hear anybody else's opinion as to what you think you would do if you were in this situation, if you would just, take that wait and see approach and not have the surgery, or if you think you would go ahead and have it done. I love to hear what everybody else's opinions are and what they think. So anybody that feels like sharing, I would love to be able to hear your opinion on this. But other than that, as I've always said in my videos, I will be back to give another update in 6 weeks to let everybody know what exactly is going on with the ovary then, where these fibroids are at. I did mention to him that I'm not using the VagFem anymore, and he said, well, I don't really recommend that because chances are vaginal atrophy is going to come back. but the pain is definitely, I would say it was in times throughout my day a 9. Now it's maybe a 1 or a 2, depending on if I sit in a certain, position. So vaginal atrophy, knocking on wood, hasn't come back yet. I'm going to keep off the Vagifem for now. I did try and use it at one point just because I felt like that burning was coming back, and God knows that's the last thing I wanted to feel. And within 2 days, the brown discharge like tripled. So I did mention that. He said, well, he said personally, I think it has something to do with something else. He said, we'll worry about that later. But for the time being, I am going to continue to stay off the Vagifem as well. For anybody who's on it, I still think it's a wonderful treatment for vaginal atrophy, and it certainly worked for me. Unfortunately, I just have these other weird things going on top of it, and so in my case, it's going to prevent me from using it currently. But who knows, maybe once I get the ovaries out, maybe I can go back to using it again, and at least I won't have to worry about a cyst turning into ovarian cancer. So that's it. Just want to thank everybody again for subscribing, just supporting me and my channel. I appreciate it more than words can say. So thank you, and I will look forward to being back then in about 6 weeks.